Why is medical gatekeeping a barrier for intersex bodily autonomy? Imagine being told what your body should look like or what treatments you must have, without ever getting to say yes or no. That's what medical gatekeeping often does to intersex people. Medical gatekeeping is when doctors control access to treatments based on strict rules or ideas about what is normal. For intersex individuals, those born with sex traits that don't fit typical male or female categories, this can mean being denied the chance to make choices about their own bodies. Historically, many intersex children have undergone surgeries or hormone treatments without their consent. These procedures aim to make their bodies look more like typical male or female bodies, based on social norms. The problem is, these surgeries are often done when the person is too young to decide. This can cause lifelong issues like pain, loss of sexual function, or emotional trauma. Gatekeeping also means that doctors decide when and if an intersex person can refuse or delay treatment. Families are sometimes pressured to agree to surgeries before the individual can even understand what's happening. This limits the person's right to choose what's best for their own body later in life. Adding to the challenge is the secrecy surrounding intersex traits. Many families and medical providers don't openly discuss these differences, which keeps people from learning about their options or understanding their identities. Without open conversations, informed consent becomes impossible. In a space that supports LGBTQ+ families and intersex individuals, respecting bodily autonomy is key. Care should focus on listening and being transparent. Not every intersex person needs surgery, and many prefer to wait until they can decide for themselves. Families can advocate for delaying non-essential procedures until the person is old enough to participate in choices. It's important to find healthcare providers who understand intersex variations and respect personal decisions. Creating an environment of acceptance helps reduce stigma and supports mental well-being. Connecting with advocacy groups can also help families learn about rights and healthcare options. They can provide resources and support to make informed choices. In the end, medical gatekeeping often puts doctors in charge, rather than respecting the individual's right to decide. Moving toward care that is based on consent and understanding helps protect intersex people's bodily autonomy and supports healthy family relationships.